This medication is used to treat arthritis of the knees. It reduces pain, swelling, and joint stiffness and helps to improve your ability to move and flex the joint. If you are treating a chronic condition such as arthritis, ask your doctor about non-drug treatments and/or using other medications to treat your pain. Before using this medication, make sure to read the medication guide and the patient information leaflet provided by your pharmacist. This medication is for use on the skin only and should be applied to clean, dry skin as directed by your doctor. The usual dosage is 40 drops for each knee, 4 times daily. Spread the medication evenly around the front, back, and sides of the knee, and let it dry for several minutes. Be sure to wash your hands before and after applying the medication and avoid getting it in your eyes, nose, or mouth. It's important to use this medication regularly at evenly spaced intervals to get the most benefit from it. Use the exact dose prescribed by your doctor and do not use it more often or for longer than prescribed. Do not use this medication for more than 3 months at a time unless directed by your doctor. For certain conditions, it may take up to 2 weeks of using this drug regularly until you get the full benefit. If you are using this drug as needed, remember that pain medications work best if they are used as the first signs of pain occur. If you wait until the pain has worsened, the medication may not work as well. And always remember to tell your doctor if your condition worsens. When using Kapzin DC 1.5% to 0.025% topical, solution in cream non-steroidal anti-inflammatory agents, NSAID, topical, you may experience skin irritation, drowsiness, or dizziness. If these effects persist or worsen, notify your doctor or pharmacist immediately. This medication may also increase your blood pressure, so it's important to monitor it regularly and inform your doctor if it becomes elevated. Be sure to contact your doctor right away if you experience any serious side effects, such as changes in urine output or symptoms of heart failure like swelling ankles/feet, unusual tiredness, or sudden weight gain. Additionally, seek medical help immediately if you notice any symptoms of liver damage, such as nausea, loss of appetite, or yellowing of the eyes or skin. While a severe allergic reaction to this medication is rare, it's crucial to seek medical help if you experience symptoms like fever, rash, swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so be sure to consult your doctor or pharmacist if you notice any other effects not mentioned. If you are in the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Non-steroidal anti-inflammatory drugs, such as diclofenac, have the potential to increase the risk of a heart attack or stroke, particularly if used for a long time. This risk may be higher in older adults or those with existing heart conditions, high blood pressure, or diabetes. It's important to avoid using this medication right before or after heart bypass surgery. There is also a rare risk of serious bleeding from the stomach or intestines, especially in older adults. If you experience severe abdominal pain, black or bloody stools, or vomit that looks like coffee grounds, seek medical help immediately. It's essential to discuss the benefits and risks of using this medication with your doctor or pharmacist. Before using Kapzin DC 1.5% to 0.025% topical, solution and cream non-steroidal anti-inflammatory agents, NSAID, topical, make sure to inform your doctor or pharmacist if you have any allergies, especially to aspirin or other NSAIDs. Also, let them know about your medical history, including conditions like asthma, liver disease, heart disease, high blood pressure, and kidney problems. If you experience kidney problems while using this medication, make sure to stay hydrated and notify your doctor if you notice any changes in your urine output. Be cautious when consuming alcohol or marijuana, as they can increase dizziness or drowsiness caused by this drug. It's important to be aware of the potential side effects of this medication, including stomach bleeding and increased sensitivity to the sun. Limit your alcohol and tobacco use while taking this medication to reduce the risk of stomach bleeding. Additionally, take precautions to protect your skin from the sun and avoid tanning booths. If you are an older adult, be aware that you may be at greater risk for certain complications while using this drug. For women of childbearing age, it's crucial to discuss the benefits and risks of this medication with your doctor, especially if you are pregnant or planning to become pregnant. Consult your doctor before using this medication if you are breastfeeding, as it is unclear whether this form of diclofenac passes into breast milk. And always inform your doctor or dentist about all the products you use before having surgery. When taking Kapzin DC 1.5% to 0.025% topical, solution in cream, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. To minimize these risks, it's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Kapzin DC 1.5% to 0.025% topical, solution and cream include aliskiren, ACE inhibitors, angiotensin II receptor blockers, cidofovir, corticosteroids, lithium, methotrexate, and diuretics, among others. These interactions could increase the risk of bleeding when used with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. It's also important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers and fever reducers that are similar to diclofenac, the active ingredient in Kapzin DC 1.5% to 0.025% topical, solution and cream. Taking these drugs together may increase your risk of side effects. However, if your doctor has directed you to take low-dose aspirin to prevent heart attack or stroke, you should continue taking the aspirin unless your doctor instructs you otherwise. If this medication is accidentally ingested, it can be harmful. Serious symptoms like passing out or difficulty breathing should prompt a call to 911 or a poison control center. In the U.S., the local poison control center can be reached at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of overdose may include severe stomach pain, changes in urine output, and slow or shallow breathing. It's important to not share this medication with others. While using this medication, it's important to have regular lab and medical tests, such as blood pressure, complete blood count, and liver/kidney function tests. Make sure to keep all medical and lab appointments and consult your doctor for more details. In addition to medication, lifestyle changes such as weight loss if needed, and strengthening/conditioning exercises may help improve flexibility and joint function. It's always best to consult your doctor for specific instructions tailored to your individual needs. If you happen to forget a dose, simply use it as soon as you remember. If it's close to the time for your next dose, then just skip the missed one and continue with your regular schedule. Avoid taking a double dose to make up for the missed one. Make sure to store Kapzin DC 1.5% to 0.025% topical, solution and cream non-steroidal anti-inflammatory agents, NSAID, topical at room temperature and away from children and pets. Do not flush this medication down the toilet or pour it into a drain unless specifically instructed. When this product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.